Hello, my name is Sandra Lopez Serrano, and I'm an emergency department nurse at Christiana Care. Today, I'm providing testimony on healthcare policy issue that affects patient, nurses, and hospital systems nationwide. That is emergency department crowding and patient boarding. ED boarding occurs when admitted patients remain in the emergency department because there are no inpatient beds available. It is something I witness almost every shift. Patients stay in hallways, families wait for hours, and nurses try to balance active emergency with patients who should already be upstairs receiving specialized care. Crowding and boarding are just operational challenges. They are patient safety risks. Research shows that when boarding extends beyond 6 hours, patient mortality increases up to 15%. Delays in treatment, delays in pain management, and missed care become more likely when nurses are stretched across more patients than the environment was assigned for. From a nursing standpoint, this situation fuels burnout, turnover, and moral stress as we try to provide safe care in unsafe conditions. Crowding isn't caused by ED alone. It reflects system-wide flow issues. Hospitals struggle with limited inpatient beds, delays in discharge, rising acuity, and lack of community resources. To address this, federal legislators introduced H.R. 2936, the Addressing Boarding and Crowding in the Emergency Department Act. This bill aims to modernize bed capacity tracking, fund pilot programs for high-need patient groups like geriatric and psychiatric patients, and require data reporting so facilities can predict and manage surges. Organizations such as the American College of Emergency Physicians and Emergency Nurses Association strongly support this legislation because it brings national awareness and federal resources to a persistent crisis. Crowding affects every corner of healthcare. When the ED backs up, ambulances must divert, delaying emergency response times. Patients experience longer wait times, increasing the number who leave without being seen. Boarding increases hospital length of stay, leading to higher overall cost. Studies have shown that ED overcrowding contributes to millions of dollars in financial losses each year due to extended staffing needs, overtime, and lost revenue. Nurse turnover alone costs hospitals between $4 to $5 million annually, much of which is linked to stressful environments like crowded EDs. This is not sustainable for patients or providers. As an ED nurse, I strongly support H.R. 2936 and similar policies that invest in improving patient flow and reducing boarding. Policy advocacy is not separate from clinical practices. It directly influences whether we can deliver safe and timely care. I believe nurses should champion policies that improve throughput, support staffing, and provide funding for bed tracking systems and specialized care pathways. Without policy support, hospitals are left to manage a national crisis with local resources that simply isn't enough. In closing, emergency department crowding and patient boarding represents a preventable threat to patient safety and nurse well-being. With strong policy support like H.R. 2936, along with data-driven funding and advocacy, we can improve patient outcomes, reduce costs, and create safer environments for nurses and other frontline staff. Thank you for listening, and thank you for the opportunity to advocate for a meaningful policy change.